But I digress. The American Society for Dermatologic Surgery says nearly 70% that is of people are bothered by their double chins. And sometimes it doesn't even matter how much weight you lose, right? You just cannot shake it. But now there is a new cure available. And the question is, how does it work? What's really involved with the process? Well, we invited Dr. Tina Alster to the loft this morning. She is a local dermatologist and one of the first people to use the new FDA-approved treatment. She joins us now live to tell us all about it. Now, are you one of the first people to actually use it or perform it on people?
That's actually a very good question. No, I'm not one of the first people to use it on myself, but I am one of the first people in the U.S. to actually use this Kybella, which is, as you know, is a fat-dissolving substance. It's composed of deoxycholate, which is a natural enzyme in the skin, in our body, to actually break down fat. And so Kybella, which is the company for Kybella, actually went through 7 years of testing and got this approved by the FDA just this past spring. And so we've been using this to dissolve fat in this, what we call the submental or double chin area in both women and men.
How does it work exactly? A quick injection, and is it an outpatient procedure?
It is an outpatient procedure, and it does involve injections. It depends on how much fat is actually there. The study actually involved people who had very large double chins. We mostly see people with mild to moderate double chins, and you can do about 2 to 4 treatments separated by about a month apiece to dissolve that fat. And it's a very simple in and out patient procedure where you would do, like, say, anywhere between 10 and upwards of 20 injections in this area. It sounds horrendous, but it's very easy, painless, because we use an injectable numbing medicine, and the chin, double chins be gone.
Is it effective? I mean, is it like, so once you do those 2 or 4 treatments, then it's gone forever, or is it something that comes back and you have to do it again?
Well, the chin appear on your forehead.
Well, we hope it doesn't appear on your forehead. Actually, the fat that's been dissolved is permanently dissolved. If you end up gaining a lot more weight, it typically doesn't go to your chin. And as you alluded to, even people who are skinny have double chins. So if you lose fat in your body, it doesn't necessarily mean that you're going to lose fat in your chin. If you gain weight on your body, doesn't mean you're going to gain weight on your chin. So once that fat is dissolved, it's gone. And people are highly satisfied. Even after the first treatment, we've been seeing a lot of people back now after their first treatment, and most of them say, I saw immediate results after the first week of swelling.
All I'm hearing here is fat dissolve. Any chance this can work on other parts of our body?
Well, that is the second question everybody asks me. Everybody says, okay, now that I can get rid of this, how do I get rid of all the other
Right.
Now
we're working on that. For women, that little pre-bra fat that you get, that's a big one. We will probably end up using it for many other body areas, but for right now, the FDA has only approved its use under the chin.
Now, I just want to know what's the downside, because every time I hear something that comes out, they're like, oh, you can do this and it'll do this, good for you, but you got to watch for high blood pressure, heart attack. If you have an erection that lasts for 4 hours, go see the doctor.
You're automatically talking fast now.
Exactly. Well, I'll tell you, the biggest side effect, in fact, you want to see this occur because you know it's working, is swelling. Everybody gets swelling. So when you have a little bit of fat here, you're going to look like a bullfrog for a few days. In fact, my brother-in-law came in and he said after the bullfrog appearance went away that first week, his chin looked much better than it had in 30 years. The other side effect is a little bit of what I call backburn. It's just a little bit of heat while the fat is being destroyed. That's normal as well, and that goes away within 24 hours. So nothing that you need big pain medications for, just a little bit of Motrin.
I thought you were going to ask, how much does it cost?
Just say, does insurance cover this?
Insurance does not cover this. It's a cosmetic procedure. Most people that I know, including my own practice, we are charging for the area, and it can be anywhere between $1,500 per session, so whether that's 10 injections or 20 injections, up to $2,500 if somebody has a lot of fat. You asked about side effects, and the only other big side effect that can occur very rarely is a little bit of numbness in the area, and that's very rare, and that's a reason why people have to be particularly trained with this. This is not a simple injection. You need to know the anatomy in this area. This is where you want to go to a board-certified physician who's had special training with the use of this product, and I have some here to show you, too.
I know everybody's different, but on average, if somebody has this double chin that they want to get rid of, how long, the total process start to finish, how long can they expect to invest in this time-wise?
Well, most people will need anywhere between 2 to 4 treatments separated at 1 to 2 month intervals. So it can be as early as 2 months from the day you come in, you get rid of your double chin, upwards of 6 months. It really just depends on how much fat is there and how long you wait in between the treatments. I tell people to wait at least a month, if not 2 months, because the trials actually were at monthly intervals.
Fascinating stuff. Okay.
Thank you
Always
very much.
something new when
I
it comes
know.
to medicine.
And really, the cutest women wear these shoes.
You guys-
Yeah, we have matching shoes.
And the magic
Yeah,
you
there
guys
you
like the
go.
Foxy twins.
Exactly. Yeah,
Black
you
dress,
get a picture,
pink shoes.
right?
I mean, if you want to be fashionable, you
Yeah,
can
well, that's
Exactly.
true.
Follow
Guys,
the doctor.
guys, you
No
really have to catch
injection
up with
needed.
us.
No injection,
No injection
exactly.
over
This
there.
is a high injection of fashion here. All right, thanks a lot, Dr. Oz.
Thank you.